Hi everyone, I'm here to talk to you about the ICU Diary project. I'm going to tell you what it is, what the purpose of it is, and what your role will be in all of it. So I will be going over it a little bit more in depth later, but this is an ICU diary. There should be one right there on the desk, and there's also some frequently asked questions handout that you can keep for yourself. I wanted to let you know that we are going to be rolling out this ICU diary project, and there will be certain patients that will be able to get an ICU diary. And what it is simply what it sounds like. It's a diary where staff and family members can put diary entries. We will chronologically document the patient's journey into and through the ICU. We will talk about all the different things that happen, milestones, trips to the OR, family that comes to visit, anything you can think of. Things that you would talk about at the bedside are the kinds of things that you would put into the ICU diary. The purpose of it is going to be to prevent post-intensive care syndrome, otherwise known as PICS. And it has been shown in research that use of an ICU diary can help prevent and minimize PICS symptoms. The ICU diary has been being used in Europe for many, many years, since the 1980s, and there actually is a lot of research out there that shows that ICU diaries can help with PICS. And post-intensive care syndrome, or PICS, is very, very similar to post-traumatic stress disorder. The same kind of symptoms result, but they are caused by a stay in the ICU. It's kind of sad to think that simply coming to the ICU is going to give you post-traumatic stress disorder, but these people really suffer after they leave the hospital, and they can't really return to everyday life because they have these problems that they face afterwards. And all of this really decreases the quality of life for our patients. So this tool is a really easy way, a little easy thing to incorporate into our care for our patients that can potentially help them after they leave the ICU. Despite being recommended by the AACN, only a handful of hospitals in the United States actually do this with their patients. At Kaiser, we will be one of the first Kaiser hospitals in Northern California and across the nation to actually implement this into our patients' plan of care. So now let's take a closer look at the different parts of the ICU diary and the staff resource manual. And here they are. The staff resource manual on the left will be stored in the West Side Nurses Unit on the bookshelf next to the charge nurse's desk. The ICU diary on the right, blank ones will be stored in the A&M office or the storage room next to the A&M office. Once the diary is implemented into your patient's care, it will be stored inside the room. We will keep it inside of a clear plastic belongings bag, and it'll be kept on the patient's bedside table as much as possible. Now, taking a closer look at the ICU diary, when you implement this with your patients, the first page here is a form that gives some information and will be filled out by the patient's family member with some contact information. This sign will also be put up above your patient's bed. It reminds everyone that the patient does have an ICU diary and to do entries daily. At the bottom here, it does give a reminder that once the patient is transferred to another unit, to store the ICU diary at the RRT desk. The diary will not go with the patient to the other units at this time. There's also some guidelines for use, and the family can keep these as well. The first section of the ICU diary is an educational section. It discusses what the ICU diary is, a little bit about PICS and delirium, also goes over many of the things that we do in our ICU already to help prevent PICS, and also gives some resources for the patient and their family while they're in the hospital and after they go home. The following section is the diary entry section, and this is an important section because the staff and family members will be using this section to put in their daily entries. An important part of this section is the bookmark. The bookmark goes on to give some information about the diary. It's a personalized message from us in our unit. And on the back side, you can see that it has helpful information to assist in writing the diary. It gives some suggestions on what to write about for both family members and staff. Important to know is that we do not skip any pages and we begin immediately after the previous entry. We sign off with our name and date, and staff will sign off with the job title and date only. For example, you would only put RN at the end of your entries and not your full name. The following section is a section for caregivers. It has some information in here about outside resources and some information about stress and relaxation. The following section is notes and questions to remember, just some note pages there for them to keep their information. And then the last section is a glossary of frequently used ICU terms. This is more of like a dictionary with medical terms so that if there's something written in their entries that they don't understand, they can reference here to get a better idea of what we're talking about. And then lastly, there's some more patient resource information. Our family letter that we give all of our patients is in there, as well as some family feedback forms so we can get more information about the diary and our care in the ICU. And then lastly, a delirium handout that is from icudelirium.org. Moving on to the staff resource manual. This will be a resource manual for the staff. It has step-by-step instructions on information about the ICU diary as well as how to implement the ICU diary. The first section has a PowerPoint presentation and it has more detailed information about PICS and the ICU diary. The following section is a step-by-step guide for the staff on exactly how to implement the ICU diary with the patient. This section also includes sample diary entries. There are many sample diary entries. These are initial entries. They're a little bit longer. And then ongoing entries, you can see that they are much shorter. And feel free to go in here and take a look at some of the entries. There's also blank copies of the entry forms if you need more. The following section is also an important section. It is the ICU diary participation registry. Anytime that you would implement a diary, you would fill out one of these for your patients, and this is how we can keep track of the ICU diary as the patient moves through the hospital and after they go home. Any information that you collect, like contact information, would be attached to this form and kept in the staff resource manual. There will be one form per patient. The ICU diary is just one more tool that we can use that can greatly affect our patients' lives even after they leave the ICU. Thank you very much. If you have any more questions, just contact me or ask one of your managers. Thank you. Bye-bye.